expand the screen.
Yeah, do we think we're live?
Yeah,
I think that's working.
is there an eye?
I don't know about the eye. Oh,
Is that it?
I think so.
Yeah.
Hi, my name is Sophie, and we're the Blenheim Midwives. We're doing a question and answer session today. We asked what themes you guys wanted to hear about. One of the themes was home birth, so we'll start with that and take your questions and just see where we go from there. So I'm Sophie, and I will hand you over.
Hi everyone, my name's Rachel. I'm a new midwife with the Blenheim team.
And hi, I'm Jade. I'm a Blenheim community midwife, and I've been in the team for about 4 years. So firstly, we thought we'd start talking about why home birth, what your options are in Oxfordshire.
Sorry.
That's okay. And then we're going to try and answer some of your questions as we go along. I think Sophie's going to try and
Find
bring
questions.
them up, and we'll answer them as we go. So in Oxfordshire, if you're pregnant at the moment or planning to be, you have 4 options. So your options are the JR hospital. There's two options actually within the hospital. So you've got our obstetric unit, which is also known as delivery suite or labour ward. There is freestanding midwifery units, so we have 4 of them around Oxfordshire. So we've got Chipping Norton, which is the Cotswold Birth Centre. We've got the Horton midwifery-led unit, based at the Horton Hospital. We've got Wantage, MLU, and we've also got Wallingford, MLU. We've also got Spires, which is known as an alongside midwifery-led unit, which is where we are right now, up on level 7 in the Women's Centre. And then the one we're talking about today, home birth, is an option. And home birth is a good option for low risk, uncomplicated pregnancies. And we'll talk a little bit about why and how we support you and how we support home birth and what we can do to support you. So to start with, just to talk about some of the evidence and why we support home birth in uncomplicated pregnancies. So there was a study, some of you might know, it's called Birthplace Study. It's quite a few years ago now, so there's been a few studies since, which we'll talk about later on. But the Birthplace Study did show that home birth in uncomplicated pregnancies, low-risk women, does increase your chance of having a normal birth. It also reduces the need for caesarean section, so that was caesarean section rate, and intervention risk. So things like epidurals, the need for epidurals, episiotomy, oxytocin drip, which is a hormone drip which we use to augment labour. Also reduces that risk of assisted births, so things like forceps and Ventouse. So yeah, lots of evidence to support it, as I say. So we'll talk a little about, I think Sophie's going to talk to you about risks of home birth.
So one of the things that, of course, women and their families want to know about is safety in regards to home birth. And the study that Jade was talking about found that home birth was just as safe as birth in a midwifery-led unit or an obstetric unit if it was your second or subsequent pregnancy. For women having their first baby, if they were to plan birth at home, they found a small increase in poorer outcomes for babies. So just to put that in perspective, the increase was from 5 in 1,000 births if you were in a midwifery-led unit or an obstetric unit, to 9 in 1,000 births if you were planning to give birth at home with your first baby. What has happened quite recently in the last year or so is that another study was published in The Lancet, and if you're someone that likes stats and research and wants to know more about that, then talk to a midwife about it, but also it is open access, so if you Google Lancet home birth, this article that came out in 2019, another one in this year will come up. And that was what we call a meta-analysis or a literature review where it looked at a number of studies and put them all together. So this paper actually looked at over 500,000 women from 16 different studies and looked again at safety for mums and babies and outcomes. And what this study found is that it didn't find the same with regard to that slight increased risk for babies with home birth. So they found when looking at safety for babies that it was just as safe to plan to give birth at home as to plan to give birth in a midwifery unit and an obstetric unit for someone having their first baby as well as second, third, fourth. So that some people found really quite reassuring and really added to the evidence that we have about home births. I'll just check if there's any questions yet. Not yet. Feel free to ask any questions if you'd like. If not, we'll carry on chatting and hopefully things that we talk about will prompt questions.
So some of the questions that get asked quite often around home birth are reasons for transfer and why you might need to come to the hospital in labour or shortly or not long after you've had baby. So there's a few reasons. I'll go through some of them. Some of them are more of an emergency than others, in which case we call a different category of ambulance to you. It's full-time critical ambulance, so we have a separate number that we call as community midwife to get an ambulance to you. So some of the non-emergency ambulances would come for things like a delay in first or second stage of labour. So if the midwife looking after you thinks that things are slowing down or not progressing as we'd like, then it will be a discussion we'd have between women and us as midwives, and we'd make the decision from there. It might be recommended. But in that case, it's usually it's not quick, it's not an emergency. Usually we've got time, we can plan for the ambulance, we can get everything together, we can talk you through it and move slowly. And we always come with you in the ambulance as well. We'll stay with you until we get to the hospital. Some other reasons why we might transfer in labour are things like meconium in your waters. So it depends on how much meconium is there. So that's baby's poo, basically, in the waters. Sometimes if it's quite thick, it's a sign that baby can be distressed or tired in labour. And sometimes we would recommend that babies have observations following birth. So ideally, you're in the hospital. So that's one reason we might call. Another reason might be that baby is just not coping so well with labour, or baby's getting a little bit tired, or we're just not so happy with the fetal heart rate. Again, we'd call for that. And then, so intrapartum reasons.
So occasionally, women, we might come to your house and we'll do or offer you a range of observations, things like your blood pressure and heart rate, temperature. So occasionally we come around and you might have developed high blood pressure or a temperature. So anything where we're suspecting something that's slightly abnormal or a deviation from normal. So things like a very raised temperature might be a sign of infection, and therefore we would need to offer you further treatment and monitoring, which we would be able to do in the hospital, like things like antibiotics or continuous monitoring of your baby's heart rate. So if we do a lot of monitoring, so offer you a lot of monitoring with the fetal heart rate Doppler, so what your midwife listens to the baby's heart rate with at appointments. So we would be doing this regularly, and any observations and talking to you, seeing how you are, seeing how you're finding things, and if there's any concerns, then one of the things that we would do is recommend transfer in. It's not always, so sometimes there's a step between staying at home and continuing and going in. We might increase the amount of monitoring or if there's a delay, in labour, we might try some things or suggest that you try some things to get your contractions to increase. But yeah, the main indication, the main reason we find that we transfer in is usually that delay, either in the first stage of labour where you're contracting and dilating, or in that pushing stage of labour. And like Jade said, the majority of those times they are non-emergency transfers. Although we would go in an ambulance, we would go in with you, you would absolutely not be left, and it's usually a very smooth transfer. Often women have that idea in their head of transfer that every single transfer is that sort of emergency where you've got minutes, and actually those things are quite rare. So just to reassure you that that's usually the indication going in.
Yeah, and some of the other reasons, so for when baby's born, if your blood loss was a little bit heavier than what we'd like, so outside of normal range, then we carry emergency drugs with us. We do carry everything that we need. However, if it was more than normal, we would recommend transfer into the hospital. Also, for tears, sometimes if the perineal trauma, so the tear is a little bit more than what we can suture at home, then if we need a doctor to have a look or review it, then it might be we recommend to come into hospital for that. Can you think of any other reasons to transfer?
Most common. No questions yet, so just carrying on. I don't know if that's a good thing or a bad thing, but we'll not get any questions.
So we'll go through a little bit about kind of the process of having a home birth and what's involved with assessments and things like that. So first of all, if you're interested in having a home birth, it's a good discussion to have with your community midwife. So they often would want to see you for an appointment, what we call a home birth assessment. So it's kind of talking about all the practical things to do with home birth really. So we talk about what kind of space you have, what kind of things you have in your house that will help with a home birth. We'll also talk about things like if you have children, what to do about childcare, and just give you tips and tricks really about home births. And then that assessment gets recorded and sent round to all of our community teams. And then, so we're all aware, so that if you go into labour, we know to expect that you might be having a home birth. Hi, coming in.
A few more members of the team joining us. So we'll just introduce you to the other team members.
Hi, I'm Tori. Hi, I'm Molly. Sit down on this tiny chair.
We do have a couple of questions have come in, so maybe we'll just come back to that in a second. So Lucy asked, how often are there not enough midwives available, meaning that you are asked to come in?
It's rare, isn't it? It's a rare occurrence. Yeah. Usually Wallingford will try and find, even if it's not a midwife from your team, they'll try and find a midwife on call in Oxfordshire to support you, try and support. If for any reason there just isn't any on-call midwives, then yes, we'd ask you to come to hospital, but it doesn't happen often.
Yeah, I mean, I haven't heard of it happening.
Once, I think, in the last couple of months that I know of, but not often. I think we're fairly well covered on call.
Yeah, and I think that's partly because Oxfordshire does have a relatively high number of out-of-hospital births, so home birth, but also birth in the freestanding midwifery units. And so we're used to there being a number of births going on that are happening, but not happening within the delivery suite. So the teams tend to back each other up. So like Jade said, it might not be a midwife from your team, but they will try really hard to get a midwife to you. And actually, in COVID, where some hospitals have stopped home birth services or reduced them, and some also with midwifery-led units, in Oxfordshire, our percentage of out-of-delivery suite births has actually gone up. So we have been able to, on the whole, support those births. She said, thank you. Lucy said, if you need to transfer, does your partner have to make their own way to hospital? So no, they would come with you. No?
No. It depends whether you've had the baby or not.
That's true.
If you are
still pregnant or in labour and we're transferring, then normally your partner would come with you in the ambulance.
Yeah.
But then if you've already had the baby, the ambulance can really only take one patient, so that's either you or the baby. So if baby's been born and they're absolutely fine, and your partner would normally bring baby in the car alongside you with the ambulance and you just all meet together there. But your midwife will always stay with you in the ambulance.
And there are situations where we might call 2 ambulances so that they can, one can be for mum and one can be for baby. So, yeah, sorry, I was thinking.
We don't expect mothers to keep up with the ambulance.
Yeah.
We will meet you here.
For a full birth in general, would having PGT stop you from being able to have this? So I think you mean pelvic girdle pain, which is a common ailment in pregnancy where the pregnancy hormones soften some of the ligaments and tendons in your pelvis, and it can cause a bit of discomfort as your pelvis is a bit more movable. So no, definitely you can still use the pool. Obviously there's how comfortable you are being able to get in and out of the water, but on the whole my experience is that people find it really helpful for their pain because the water's warm and you're a bit more weightless. How long do you tend to stay post-birth if no major complications?
So, a couple of hours maybe, not always that long actually, if everything's very straightforward. We check that baby's feeding, baby's had a feed before we leave. We want to know that your blood loss is all well controlled, that it's not too heavy before we go. We like to know that women can pass urine as well before we leave the house, just to check that the bladder sensation's still there. And we do things like suturing most of the time at home, as we were talking about earlier. And we make sure that you've had something to drink, you're fed. We like to tuck you up in bed. We go through all the contact numbers. We give you all the information that you might need before we leave.
Yeah, so it depends, but like Jay said, especially if you've given birth, maybe it's not your first, you've not had any tears, you don't need any suturing, baby's latched on and fed, you're both well, then maybe a couple of hours, but sometimes longer, depending on what you need. And then we would come back the next day to see you. So if it was, say you gave birth at 3 a.m, we might come back what technically is the same day, maybe in the afternoon or the day after, or at least checking on the phone. Does that help? Should we go back to a little bit of what's involved in home birth?
Yeah.
Be more.
So once we've done that home birth assessment and we're sort of aware that you want to have home birth, the next thing we wait for is when you go into labour. So when you go into labour, we ask you to contact Wallingford. So the number should be at the front of your blue notes, and then you can just ask your midwife to show that to you next time you see her. So what they'll do is they'll take the phone call from you and do a quick assessment, and then they'll decide whether it's worth you being assessed by the closest midwife to you. So they'll try to get you a midwife who's part of your community team. But all of the calls kind of go through Wallingford, and then you'll be called next by the midwife who will come and see you, and they'll sort of triage you and discuss everything in terms of your labour so far. And after that they'll make their way towards you. So we bring a massive kit of stuff with us when we come to home births. So that basically has everything that we need inside it. So it has some types of interlocks, so the gas in there, which we bring with us. We have everything we need for baby. We also bring a kit with us. Just in case baby needs any kind of support with breathing when they're born. So we bring all of that kit just in case. And we also have things for baby like vitamin K, if you've discussed that with a midwife, everything for the cord and the placenta. And we also bring the drugs that we can offer to help deliver your placenta, or what we call like an active third stage, so drug called Intrapartum. And then, yeah, it's just all of your notes really, or things like that you bring. Is there anything else I've forgotten?
No, it always looks quite a lot.
Yeah,
When we're around on
yeah.
the doorstep with the home birth kit, it actually looks, we've got quite a few rucksacks.
Yeah.
However, most of it we don't, we don't need, we don't even
Yeah.
open, we can put them to one side into another room,
Yeah,
so they're out of, of view, but however, they're there, we've got them. A lot of it is emergency drugs if need be, but we don't necessarily use all of this.
It's all just a precaution, just in case.
Yeah.
Yeah. And just talking a little bit about pain relief as well. So, any kind of paracetamol or ibuprofen which you'd already have in your home. But if you wanted something stronger than that, then we obviously can bring our canisters of gas and air with us. But we can also offer you an opioid injection called Meptid or diamorphine. But that's a discussion that you'd have with your midwife and request before you went into labour. So you'll probably do that as part of your home birth assessment and just make a note to say that you're interested in having that form of pain relief.
So there's a few more questions. Not specifically home birth related, but obviously open to other questions. How long is the average stay post-cesarean section? So if you've had a really straightforward cesarean section, you may just stay a couple of days, or even in some situations, if you, for example, have a planned cesarean and everything's really straightforward, you might have it in the morning, stay one night, and potentially even go home the next day. Obviously, if you have more complications, then you may stay as long as you need. But yeah, that's sort of the minimum, is 24 hours as an absolute minimum.
It's just about making sure that feeding's going okay, same as everybody else, and that your pain is kind of manageable and well controlled for when you go home. But yeah, mostly just one night now for cesareans.
Yeah. Lucy's asked, what is the current situation with the number of birth partners at home births given COVID? I'm anticipating that my husband will be my primary birth partner, but also my daughter of 2 will be in the house with my sister as her main carer. Will they be able to come in and out of the room as feels right for my daughter? So we would still ask that you, the same as in hospital, have one birth partner, but completely understand you've got to make provisions and organise your childcare, of course. But I think potentially in your situation, which many people have in their second baby will have, is we would ask that your daughter and your sister are in another room, and so we're not in contact with your sister. If you ended up wanting your daughter to come in, which we understand, then potentially your partner would be in the room with her. So it would still only be one birth partner with yourself and the midwives, even though your sister is in a different room available if your daughter's not going to be in the room.
And that's the same that applies to our postnatal visits as well. When you come to the house to see you, after we'd ask that other family members are in another room and that it is just you and baby when we're visiting.
Yeah. And obviously, if your birth partner, and again, same if you're coming into hospital, developed COVID symptoms, then we would ask that ideally that you have a backup birth partner that could take over. But again, that's not specifically home birth. Is the medication for active third stage the only, you said online medication, but maybe you mean only medication you bring? Maybe re-comment, but if not, I think we can answer what I think you do. If labouring at home, when would you expect the midwife to arrive?
Depends when you feel like you want them there, really. And so normally you call Wallingford when you feel like you need to speak to the midwife, or you want to be assessed, or feel like you need a bit of extra support. And I suppose it would normally be the time where you'd feel like you needed to come into hospital, you needed to come into Spires because you feel like you maybe need a bit of extra support, or you need a little bit more reassurance, or some help with pain relief, and that sort of time. But being at home, the midwife can come and assess you, and then you go home again and come back again, so it's quite flexible. But I would think about it kind of as if you were at home and you were thinking, okay, now I feel like I need something extra, or now I would think about going to hospital, that's when the midwife would come and see you at home. But whenever you feel like you need extra support or assessing, really.
So just to add to that, Louise has said you'd like to know this too, especially as it's my second and sometimes they come quickly. So this happens a lot, and if you are even unsure if you want to be at home or in hospital, sometimes we'll encourage you to plan for your birth to be at home. Say, for example, the last baby you had, it was really quick. And what we'd do in this situation is we would highlight that on our home birth sort of assessment that we do with you at sort of 36-ish weeks, so that the team know that potentially this might be a rapid birth. And then usually, again, when you ring Wallingford to say what you're feeling and how you're labouring, you can also add that information then and say, this is my second or third and my first was really quick, or we're expecting to be quick. And then often Wallingford would give us that information and we might call our second midwife at the same time. So 2 midwives, we would plan to be at your birth for the actual, for the delivery or towards the end of your labour. So this is something that comes up quite a lot. We're used to it, don't worry, we're not going to question you, especially if we know it's something that's a possibility. So just tell your midwife in pregnancy and she'll add that information, and tell the person that you speak to when you're in Wallingford. We'll get there as soon as we can.
And if things are progressing quickly and you think baby is coming, then you can call an ambulance. And the paramedics will come to you. If you think, that we're not going to get to you and actually baby is coming right now. Yeah, then do. Because they will come. We will still come. The midwife will still arrive.
Yeah. And it's not to take you in, but just so that you've got people with you for the birth. I don't know if we should talk a bit about if you are expecting that to happen. I'm thinking at home and I don't want to call you out about too soon. That's very kind. But don't worry too much. The midwife would probably rather get there, spend a bit of time with you, and then you have your baby, than rush in with 3 rucksacks, throw them down and catch a baby, which I have done, doorstep catch. But so don't worry. If we think if we're not sure, we'll have a conversation with you, and if it's really obvious, we'll just come.
And we always call you before we come anyway, unless we've been told in that scenario that the baby is coming and the ambulance is like, so you need to go, then we just go. But if it's routine and you're labouring at home, then we'll always call you first to say, my name's Tori, I'm coming out, and just ask you a few questions, again, about your contractions, how you feel like you're coping, what you feel like you need at this time. So we do a little assessment on the phone before we come out, and then we can either say, why don't you call us back again in an hour or 2 hours when things have changed, or we'll come out now and assess you. So again, it's very flexible. Yeah.
And we don't mind if we come out and assess you at home. We feel like we can have that discussion. If we go away and come back in an hour or 2 hours later, that's fine. We don't mind coming out.
Tori, would you like to talk about your role?
So I've just taken over running the positive birth group with a lovely local doula called Maze. So it's like everything at the moment, an online kind of group surrounding positive birth. And it's a national thing, so every month we have a different topic, and home birth is included in that. So we meet, I'm not really there as a role as a midwife, but more to kind of lead discussion, answer questions, and talk about what a positive birth means for everybody, because it's different for everybody. This month, it's the last Wednesday of every month at 6:30, for however long we run for. And this month is all about oxytocin, so how we can get natural oxytocin going, and then of course that leads into induction and what that looks like. So it's a topic that people tend to have lots of questions about and lots of reservations about. So if you want to join us, then go on to Positive Birth Movement Oxford on Facebook, give us a like, and all our information is on there. It will be on Zoom, and we do record the session, so if you feel like you're not going to be able to be there, then we can always email you a recorded session. But it's helpful to have lots of faces to ask questions and get the conversation going. So if you want to know anything more about you know, a home birth or positive birth and what that might look like, then please come and join us. The home birth group Oxford as well is still running, and that's also a really great group. Women go on there and talk about home births that they've had or upcoming, with lots of great advice as well. So that's another good one to find on Facebook.
What's that look like at the moment? Is it virtual sessions or
Also
is it
online? Yeah.
And how often do they run?
Once a month as well. Yes. I'm not sure what day it is, but all the details are on the Facebook page. Yeah. But, our positive birth groups last Wednesday of every month. So I think it's on the 30th. Next month. Yeah.
Lucy also said, do all the home birth midwives carry gas and air? Yes, so when we go and get our kit, we would definitely get gas and air as well. Because even if, most people will keep their options open in terms of pain relief, but we want it to be easily accessible if you want it. So yes, we would bring it. Occasionally we run out of gas cylinders, and usually we get somebody else to bring us some. So that shouldn't be a problem at all.
Did we mention methods? Yeah, so that is available through your GP. It's an opiate, so that can be used. Some women choose to use them at home births. If you're thinking you might like that, it'd be worth having that discussion with your midwife and GP. The GP will prescribe that.
Yeah. And obviously some people choose to hire pools, which is a good option, or look into getting TENS machines. So actually, if you want to have as many options available as possible, which I think is a good idea, then you can have access to everything other than the epidural if you sort of look into it in advance. So definitely have a chat with your midwife, because we want home birth to offer most of the choices in terms of pain relief that you can have access to elsewhere. So we talked a bit about the groups from Tory. Other places that you might find information, if you want to, you can look up the study that I talked about in the Lancet. You can also look up the Birthplace Study that we talked about. That's, again, you can Google that. If you go onto the NHS Choices website and put in birthplace decision, there is like an information booklet which has come off the back of the Birthplace Study, but for women and their families, to try and help explain the findings of that in a more clear way, because it can get a bit complicated. There's also the national guidance, so NICE guidelines on intrapartum care, which means labour. That's got some information in those. There's AIMS, which is the Association for the Improvement in Maternity Services, and also the Birth Rights charity have lots of information about lots of things, but there is home birth information as well. No questions. Anything that we haven't covered, or
People quite often ask about how they can prepare at home, things that you can get ready. So some people choose aromatherapy as well in labour, which is something which we provide here in the hospital. However, obviously we recommend, if you want them at home, that you get some in for massage or inhalation, or however you want to use it. So it would be good to get a base oil in, and whatever oils are preferable to you. So you might think about that. For massage is certainly very good in labour. Other things, low lighting, as we do here, so you might want to think about candles or little lights, smaller lights or lamps around the room.
Music, it's really nice to have a playlist of music. Works really well in those first stages as distraction. I often suggest that having, like, if you had a playlist for your wedding or something that brings back those really nice memories, it can get the oxytocin going and make you feel really comfortable. That's quite nice.
It is good to have some I think midwives are quite house proud about keeping things
Yes.
clean and tidy and a mess, actually. So if you have some towels, that helps. We bring with us some pads that we put down. A plastic sheet is quite useful, either something like a shower curtain or something bigger from a garden centre or something. That's quite good because we can put it, say, over a sofa and onto the floor and then towels on top, and then that usually means that your sofa and your floor is not at risk. And yeah, we'll take away most stuff with us when we go, and yeah, obviously not your towels, but then we wash. But, I've got a few more questions. Can you have a home birth if you're on scan pathway D? So what we've talked about today and in a lot of the research that we've talked about is based on women that have had straightforward pregnancies. However, we very much, as midwives and the maternity unit, want to support your choices and recognise that doesn't always, fit into the same category for everybody. So, absolutely, if you would like a home birth but you're not necessarily completely falling into that straightforward pregnancy category, we would support you with that. What we would want to do is make sure that you had all of the information, that you know how your individual pregnancy is affected, might affect the information that we've given today. So definitely talk to a midwife about it. She may refer you to see our consultant midwives, or offer you an appointment with our consultant midwives in their clinic, which is called Homebirth Clinic. And their role is really to make sure that you've had all the information, that you've got all your questions answered, that you understand benefits and risks of all the different settings. And if after that you've made an informed choice that you'd like to give birth at home, then we would support you with that, yes. Anything to add on that?
No, I think that's,
Yeah. Do you have to wait to be a certain dilation before going in the pool at home?
No, I don't think so. We wouldn't necessarily offer an examination before you get in the pool or anything like that, unless you obviously wanted us to, but it's more about kind of judging that stage when we think the pool will be really beneficial. Sometimes in that late phase, the early stage of labour, the pool is so relaxing that it can slow, your tightenings and your surges and contractions down. So in that case, we might ask you to get out again for a little while, do a little bit more mobilising, that sort of thing, to kind of really establish those contractions. But that just comes with the stages of labour more than cervical dilations. I wouldn't say there's a magic number before using the pool. No. And it's your birth and it's your choice. If you feel like, oh my gosh, I just need to get in the pool for a bit of relief, then it's absolutely up to you. And there's no reason why you can't get in the pool before we arrive. If you're waiting for a midwife and you feel like you need to get in the pool, then you can absolutely get in the pool before we get there.
The only situation we might say don't get in is if you think you're going to have your baby, and we're not there. Again, you can obviously do what you want, but if we think that potentially you're going to end up having your baby without a midwife there, then I definitely encourage you to be on land, as we say. That's the only sort of reason I can think of. Any other? Oh, there we go. Are these just questions about home birth, or can we ask anything? No, you can ask anything. That's fine. Yeah. We'll just wait a few more minutes to see if Bex comes back. You mentioned students at all?
Not yet, actually.
Do you know?
Yeah, sure. So usually there'll come a point in your labour where we call for a second midwife. That's routine whether you have a home birth or not. We do it in the hospital as well. It's just so we have an extra pair of hands to help us around birth, because sometimes it's too much work for us to do with 2 hands. But also another thing to mention is as a trust, we have a link with Oxford Brookes University, so we have a lovely team of students, student midwives who some of you might have met already at appointments. Sometimes these students are also on call with their mentor, so the person who teaches them. So it might be that when your midwife is called to come to you, they'll also give their student a ring and say to meet them there. So there'll be the two of them coming to your house. I'm not completely sure what they're doing because of COVID, whether they're still letting students go to homebirths. They are, yeah.
We'll always ask,
Yeah.
you know, we always ask you when we know whether you're happy for students, because it's completely up to you. If you decide you don't want students, that's fine. They will always be working alongside a midwife.
How is the baby monitored whilst in the pool? Do you have to get out? No. So we do the same in the pool as out. So we have the sonic aid or the Doppler. Most of those that we have are waterproof. So we can't, the probe part we can put underwater. So you don't have to get out. Sometimes it's harder than other times to find the heart rate. So we might ask you to come a little bit closer to us to save our backs, or so that we can find the heart rate more easily, or change position. But most of the time, once we know where it is, once we've sort of first got there and had a feel of your tummy, then it's fine to listen in the water, so you don't have to get out. Regarding C-sections, at the moment my friend is a qualified birth photographer, and I know this will be my last baby. Is that something that's not allowed?
I think they're limiting the amount of people that are in theatres for C-sections just due to the risk of infection. So it's normally just your partner that can come with you, or your birthing partner would be the only person that would come in. We wouldn't allow for any photographers at present.
It's also with birth photography in theatre particularly, we ask that you don't take pictures of any members of staff's faces. So you can ask your midwife, they might consent, but in theatre there's normally a team of between 8 and 12 people anyway, so it becomes quite difficult to not get anybody's faces in.
And I know it's not the same as having a birth photographer, and maybe the pictures you're talking about are more detailed than others, but if the midwife can, usually the midwife will say, do you want me to take any photos? I know it's not the same as a birth photographer, but we are happy to help take photos for you of you and your partner and your baby. I appreciate that. It's not ideal, but at the moment, no. If the baby arrives on a home birth before the midwife arrives, is there anything you should do in regard to delivering the placenta? Baby's cord, my husband is worrying. I don't have the answers though.
Just keep your baby nice and warm. Pop them under your top or skin to skin. Make sure they're not kind of sat on anything wet. Just give them a little bit of a rub with a towel, and then put a dry towel on them, and just keep them on your skin. You don't need to worry anything about the cord or the placenta or delivering it. Just leave it well alone. Just enjoy a little bit of skin to skin time with your baby. And then either when the paramedics arrive or when the midwives arrive, they will deal with the cord. You can offer for your husband to cut it and help you deliver the placenta and all of those things. So I don't think it's anything that you need to do.
I don't think TV helps with that, does it? Because they always start cutting the cord if no one's there, but definitely leave the cord. The only other thing is, if you are thinking that you're going to have your baby and your husband, it's just going to be your partner there, just a good position to adopt is maybe all fours or kneeling or something where you're low on the ground, just for the catch, not standing, unless your husband's really confident in catching it, but just to avoid that risk of the baby falling. But if you're low down on the floor, kneeling or fours on the bed, then that's perfect. How long is the average stay in hospital after a birth with no major complications, and how long is your partner allowed to stay with you once the baby's born?
So I guess up here on Spires or on delivery suite, if everything's really complicated, you can go home 4 or 6 hours later. You don't necessarily have to stay overnight. Most people choose to stay overnight just for feeding support, mostly. but you can go home. So if you choose to go home and have an early discharge in that kind of 4 to 6 hour first window, then your partner will be able to stay with you until you get discharged if you're going home directly from delivery suite or directly from a delivery room on Spires. Otherwise, your partner can stay with you downstairs or here until we transfer you to the postnatal ward or a side room, which again, it doesn't tend to be 1 hour, it tends to be kind of 2 to 4 hours where you have that time, you know, whilst we wrap everything up, get you both something to eat, some tea and toast, and then, yeah, when we transfer you to either a bay or a side room on Spire, because when we'd ask them to go.
You said you work with a doula at the midwife-led units. Can we have your doula as well as our partner? Maybe that's...
No, I work with the doula for the Positive Birth Movement group, so she runs the group with me, so we don't work with any particular doulas in the midwife-led units. In non-COVID times, you can hire yourself a doula and then have them as your second birth partner, but again, during the minute with COVID and reducing footfall in hospital, we're asking that you only bring one birth partner with you.
That's all the questions that I've got. We'll just wait a couple more minutes to see if any come through. I think we've maybe can't think of anything to add that we've not gone through or answered in response to questions.
I just think if you're planning a home birth, I always say that you need to labour somewhere where you feel safe and comfortable. And I think that's particularly prominent with a home birth. You know, and you can always change your mind when you're in labour. Just because you say you want a home birth, it doesn't mean it's set in stone.
No.
But you labour the best where you feel safe and secure. So whether that's at home or in hospital, just make sure that's how you feel about where you're planning your birth.
Yeah. And, you know, please do feel that if you're undecided, so if you're, let's say you can't decide between home or a birth centre or delivery suite, but if you're really not sure and you want to see how you feel in labour, we are happy for you to plan a home birth so that we know that it's an option that you might choose and then decide at the time. That's something that's fine. You don't have to make an absolute decision in advance. Yeah. And you can see how you feel on the day. No, you don't tend to know how your labour is going to go or how you'll feel. So yeah, that's definitely an option if you're not sure. Lucy said, thank you. These question and answer sessions are so helpful. That's really nice. It's probably not the most comfortable doing them. It's a little bit of an understatement. So it's nice to have some feedback. All right, one more. So Victoria lives on the border of Oxford and Bucks. My midwife is Bucks, but my care is at the JR. If I had a home birth booked with my Bucks midwife, can I transfer to the JR if necessary, or would it be Stoke Mandeville? So I think if I'm right, your area is Buckinghamshire. Yeah. So if you want a home birth, it would need to be the Buckinghamshire midwife, as you said, that comes to your house and does the home birth. On the whole, if it's a transfer, and the distance isn't, I actually don't know the distances that well, but if the distance isn't much greater, and say for example you decide that you want an epidural in labour, so it's not an emergency transfer, they might consider taking you to the JR. Although you'd have to be booked with Buckinghamshire, so it does become a bit complicated. Mm-hmm. In an emergency, absolutely, they would take you to the nearest hospital. So if it was time sensitive, then you would go to the nearest hospital.
Yeah, discuss this with your community midwife,
Yeah.
and they'll advise you, because they will know. Yeah, your community.
Those midwives who work on the borders know how things
Yeah,
work
they
better.
do.
Yeah, we just work in the city and we always default to here. So speak to your Bucks midwife, and if you've seen a midwife, you know, from Oxfordshire on the borders as well, ask them. They'll know the protocol better.
Okay, I think that's maybe it. Alright, so thanks very much. I hope you find it helpful. And we're going to put it off now.
Thanks, bye.